Hello, welcome back. This is Dr. Jerry Cuomo. I'm here with another implant rescue case. This is a Biomet Zimmer 3i, color code blue, certain, prevail. And our periodontist here in Florida has recommended this patient to come see us for a rescue. There has been prior access here. I'm just going to be checking with my dental assistant now to make sure I'm in focus. And right about there. So now you guys can actually see what's going on. So there's prior access. You can see where they deviated off to the side and they nicked the inside of the implant fixture, as well as the side of the threads, the first threads. So we've got to go in the middle and do a drill out, a core drill out. It's not going to be easy, but we're going to get going today. Hopefully we got all our ducks lined up. We're going to start with a quarter round. Handpiece is ready. All right, let me have a regular contra angle, from the other room. So that's the first step, step one. Always the most important step. If we can get something in there, then we can undo it, unscrew it somehow, whether we do a slot, turn it, do something to make this happen. Nothing's easy, but we're here to make it happen. Okay. So we're going to go to, either we're going to be using very long shank burrs, or we're going to be using a shorter shank. So that's our choice today, choice of two. Let's start with the shorter shanks. Quarter round burr, so we're looking at a very, very small diameter. Do that first. We're going to be using lubricants. One is called Crisco from the Crisco people. We'll use that first. First thing I have to do is drill a perfect pilot hole. And my dental assistant's going to be using a surgical suction white. I don't mind what you got it. Okay. So we're going to pre-soak every case with tartar and stain remover. Pre-soaking now. Open wide. It's on the end of a anytime there's a fractured any kind of a fracture, screw fracture, you always want to pre-soak with tartar and stain. I can't help it. Continue to say that. Are we in the middle? Focus? Okay. Just want to make sure that everything's in there. So one of the things I'm checking, next mirror, gray mirror, yep. Entree? Oh, okay. There we go. Is angulation. You want to check the angulation. Looks like it's more toward the lingual. From lingual to buccal. Lingual to buccal. Lingual to buccal. And we're also looking at the color of the solution as it goes from clear to a more of a grayish color, and that means that we're getting penetration as we're dissolving particles all in the path of removing this screw. It's a very small-ended screw. It's no bigger, maybe 5 threads to it. Like I said, prior access almost sealed the deal on this one already. It's a difficult case, very difficult case. It's going to require a special corkscrew. We'll look for that in a little bit. Microsuction next. Transferring. Okay. Now we'll zoom in after we've pre-soaked a little bit and go ahead and see if we get any movement. I have a long explorer going in, and we're just going to see if we have any movement whatsoever. Looks like they cold welded the side in. Oh, we've got some movement, folks. Very slight, but it's there. Saw it move. Saw it move. Okay. Let's make sure we're still in the middle. I'm going to put a little oil down in there. That's just regular machine oil. We just want to get that nice and lubricated. See if we can slip it in there. Cause a little emulsification process. Try to get that to move. Alright. We'll leave it in there and try to work it back and forth. See if we can get a good turn. It's always nice if we can get a good turn. And we'll go back the other way. And we're just going to work it back and forth. And then we'll take a microsuction. Now this is on tooth number 30, so you imagine we are indirect all the way on this one. Impossible to see around teeth. Transferring out. Back in with our long explorer. Trying to stay in the divot so I don't cause an issue here. And so we have to go from left to right, and that would be counter-rotational. That's what you want. You want to get it out with counter-rotation. Let's try this again. There's the movement back. Now we want the movement forward. And movement back. Movement forward. There's only so many times you can try to get it to turn, but it's being blocked by the problem area. So let's just try to stay away from that. We'll try to move it this way. Go over here. Alright, we got it to turn. So we got a quarter turn out of it. Let's soak it up again. Why not, right? Why not? And that'll have to be cleaned off with alcohol. Let you do that. Or tissue. Tissue on it? Yep. Okay. So that's tartar and stain again. So I went from tartar and stain to oil to tartar and stain again. So we're mixing it up. We're learning a lot, folks. We're learning a lot from these cases. Getting a lot of attention. Getting a lot of people talking about us, what we're doing. Not many of us. As you can see, it's a gold tight screw, a gold coated screw. That's put out by the company because they want to try to make these screws more retentive. I would imagine that's their object, is to make screws more retentive. But honestly, I think that the gold is, in my opinion, kind of gets in the way maybe of trying to retrieve these, because it's a very thin coat and might come off sometime. You know, you're trying to retrieve it, gets it caught in a thread. So if we can get one full turn on this screw, we might be able to just get it out through conventional means. It does take time though. I'm going to stay on the good side. Stay on the good side. Everybody should stay on the good side of things, right? Alright, I think it's time to start zooming in, so we'll do another zoom in. Almost a complete turn. You can see the damaged area leading the way here. Try to stay away from it. Alright, still making the turn. Yeah, it's like watching the gas grow, but at least we got a movable part. So it's categorized as a type 3, so we know it's broken below the first screw. The first thread, that is. Okay. So we did one turn, we have 5 to go. Now as I'm turning, I'm fighting his buccinate muscle as well. So we're going to pre-soak it again. We'll suction it out. So it's a type 3. If we were type 4, we would have a complete cold lock. And you can see the threads now on the first thread very distinctly. Again, there's some internal damage, no doubt about it, from the previous operator. Let's see if we get a turn on this. There we go. Very cool. Alright, going on turn number 2. Number 2. And we run into another block. So there's stuff down in there that has to be dissolved out. So let's go after it. Trust your brain, not your eyes sometimes. Some more TNS. Drop down the mag. Right in place. Keep the soaking, that's the key, guys. Keep it soaking. As long as you're soaking, you're good. So if you can do this by avoiding heavy instruments, by all means, keep it going. Almost ready for a, what we used to call a triangle, now we call it a cheek buddy. Which I like. I like that term. Cheek buddy. Yeah, soft terms. Here we go. Going right in? Right in. Okay. How about that, folks? We got a loose screw in there. And we were anticipating a cold weld situation, you know, when you lock something in. Yep. See if I can move it around. Oh, saw a bubble come up. That's good. It's penetrating down. You see bubbles come up, it means it's doing its thing. It's getting past the threads. You can vibrate it a little bit. Yeah, I like that. Here's another bubble. Like that. So as it disappears, that's a good thing. Why is that? Well, you gotta ask. Are you okay? Did you wake up? You woke up. I hurt you? I pinched you. Am I pinching you? You okay? Alright, sorry. Nothing electrical here. Okay, so we're on 2.5 turns, if you're counting, right? 2.5. Yeah. Okay, we'll get that. That's been in there for a little while. Go ahead and get that out. Once it breaks the top, gets to the top of the, well past the first thread, we're in good shape. So it's right now. It's just a slightly oblong, just a little oblong, just a tiny bit. I don't know how anyone can go in there. It's almost blind, when you go in. When you're going in blind, you're guessing, and that's no fun. So with a microscope, we can see right down center. See, that's center, this is off center. So you can imagine if you're trying to go in, you really got to figure out what center is. Now they make kits, but the problem is the centering devices move around so much. That's the real problem. They move. I'm gonna see if we can suck that out now. Okay, it's pretty cloudy in there. I'll keep the suction on it and see if I can turn it with the suction. Okay. So there's a damaged area. You see it's color-coded blue. So there is a damaged area. You can see real close, like toward the lingual, you can see. Okay. You can see that. See, it's oblong. So we got to get past that. If we get this screw to come up past that, we're in good shape. We're in good shape. So let's give it a try, shall we? Keep it turning. Here it comes. Or the idea that this was loose for a while and the whole thing is oblong inside. That could have been the other problem. Oh, it's coming. Huh. It's a little oblong. This is the only method that I can utilize because I can see what I'm doing. The other method would be blind. Okay, that's 3. So with this type of suck out, we're going to use a bigger, well, I think the yellow would be alright to use. Yellow's going to be fine. We'll get it. It's coming. Are we still in the center? Is center now? Okay, just keep me in center. Okay. As long as we have movement, I'll keep going. If we stop, I'll soak some more. Alright, here we go. We're way above the first thread, folks. Going on 4. Remember I said we're going 5 on this one. Now I've got a special instrument that will, as soon as I get it past this first threaded area, I'm going to use a special instrument to undo this. And it's a fork that I customized. And it'll get it right out. You see they have a very long shaft to this screw. That's the other problem, is wherever it breaks between the screw, threads, and the shaft. That's the other problem. Design. So the gold tight and the actual design of the screw, those are the two things that kind of bug me the most about this type of screw. Whoever's using it. I don't know what the answer is as far as design. Maybe they can come up with something a little more strong, more rigid. So if it does break, it breaks further up above the screw thread. Maybe build something into it so that if it did have to fracture. Do you need a break? Almost done, sir. You want to take a rest? You alright? Keep going. Alright. Thumbs up. Yeah. Okay. Going back in. Gonna put a little tartar and stain down in there. Yeah. Get that right in there. We're cooking Implant Rescue today. We're all about Implant Rescue. From prior access, nobody knows. It's all blind in there when they go in. Can't see much with dental loops. You try. Maybe you get 1, maybe you get 2. Then it's always that one you can't get. Patient doesn't have many options except try to find somebody to get it out. It's not easy. It's a commitment, you know, to using a microscope. It'll help your game, help you be a better dentist, give you perfect clarity on implants, whether you're seating your own or doing your own surgeries. Just about have it out. You know, it's material and this gold stuff. You'll see when it comes out. I'll show you what the screw looks like. It'll have a whole bunch of stuff wrapped around the threads. It's gonna zero in again. So if you look at it, you can see where we are. We were so far down below that first thread. Now we're up higher. Now with the back, I'm going to just bring him up just a hair. Okay. Just need a little more focus here. Okay. All right. That's just grit. I'll suck it out again. Alright. Sorry. The suction devices can't even move it. It's just gritty inside. We're going to put some oil down in there again. Coming up on, I don't know, 45 minutes or so. Here we are, folks. Still at it. Any of you falling asleep out there, it's okay. I understand. I totally get it. It's like watching the grass grow here. Spinning it around. We could spin it back, but we don't want to do that. We want it to go forward. So there's something causing it to not want to come. So let the oil do its thing. There we go. There we go. There we go. Oh, what do we use? We use handpiece oil. Sorry. Get the idea. Pretty soon it'll be floating in there, and then we'll suck it up, but I think it's time to get an instrument so we can turn it and get it out. We're well past you know, can't fight success here, but you know. Alright, let's just do gently. We've got a turning instrument. I'll go ahead and get that now. We want to check the diameter of the screw itself, so I have that. Alrighty. Got some really unique ones that we've made for Oh, different cases, different things. Let's see if this will do it. So if this is the screw diameter, this looks like a crown. You know, we make these, we autoclave them. That should fit nicely around the top of the screw and just kind of turn it out without forcing anything. We pre-dip it in oil, and so it's covered with oil. Now we're going to go back in the mouth under low magnification because you want to get a true alignment. Open nice and wide. And this is where I'm going to come off the screen. I'll keep it in the screen if you can keep me posted. Small mirror. Okay. Retracting. Going in. Let's see if we moved it at all. I don't have a smaller one here. Nope. Okay. Sorry. Gotta get in the middle. Large mirror. There we go. Oh, absolutely. So you're going to see it's pointed to 2 o'clock right now. So let's drop back down. It's at 2 o'clock. It's about 5 to 2. Sorry. I found the hole. Go in it. Turn. Finger. Turn. Okay, suction is on. Okay, we've got it. Then we have the large screen suction. And now you see it. Now, it's right in the middle. You see it there? There it is. Here it is. There's our screw. So she's just going to go right flat end right on top of it. Put the flat end right on top like that. Not quite. Yep. It's either on your screen or we sucked it through your screen. It's probably through your screen. Okay, it's out. Look in the mouth. Check. Nothing there. Okay, our screw's out. Microsuction next. Alright, well that's the one that got away. But we got it out. So that's all we care about. Usually that screen catches them. So we're successful in getting the fragment out. We did it with this instrument. It's called just a fork. Make these all the time here at the office. And it's sharp enough to grab at the edges of it. Comes right out. So now we got to clean that, right? We're going to just hit here and clean, and you guys know the rest. We're going to test it for function and vitality so he can get back to his dentist and get it made. Now we have another project to do today, and that's maybe to do this filling. We'll do a DO composite on number 2. I think we can do that today. It's just a little repair. Patient wants that. I'm okay with that. We got time. Another hour here. You can let Phyllis know we'll be done inside of, we're going to be putting cotton and a plug back in here.
Sure.
I heard her. Great. Just like Tony the Tiger.
Exactly like Tony the Tiger.
Yeah, you can see how dark it is down there. Look at all that bioburden. That's what held the screw in. Too bad I don't have that screw to look at. I wanted to see what was really holding it in. You know, your implant companies, I think they do. I'm not sure, don't quote me, but they might warranty this. Let's go ahead and do a microsuck in it. Check with your implant companies. They might cover the screw itself, you know. At least it's something, you know. Take a look all the way down there, folks. You see the threads? So it's just the first ones that got boogered up a little bit or beat up a little bit by the operator. It's too blind in there. You can't really hit the center. You veer off one time. That's because when a screw fractures, it's never a concavity. It's always a convexity. So as soon as you touch the fracture line, you go off. You're going to go off, and you'll hit. And it's too easy to veer off the side. Plenty of videos out there I've already made. One was on. Now we do cover restorative as well, but one was actually on drill outs, complete drill outs. I just put some up there on a really good drill out of an abutment. So this one will be up later on tonight. Get this one out to you. Got about 8,900 subscribers and growing pretty good. So we got people flying in from all over Canada, California, New York, Connecticut, overseas. Alright, one more suck out and then we'll rinse it all out. Test it. About 32 minutes here filming, folks. Half an hour, not too much time, more time. And then we'll rinse it out with regular tap water. That's what's next. Little tap water rinse, another suck out. Looking good. Happy day. Oh, happy days are here again. Sorry. Okay, microsuction. Our number here is 561-391-6290. If you need us, just talk to either Phyllis or Victoria. Make an appointment. Be happy to catch any and all photos or x-rays via email. We'll rinse it out again. Sorry. Cold? Cold? Yes? Sorry. Okay. Last one. You alright? Attaboy. It's cold. Sorry about that. We can warm it up, but it'll take another 5 minutes to warm up our water. It's got a built-in heater. We're done. Yep. Hey guys, nothing I can do without my team. They're the A team. You know, if you don't have an A team, you're gonna be lost doing this. So get a good team, and you're gonna make miracles happen. All right, let's go next step. Check it now. We're gonna actually check it out for functionality. Here it is. This is an impression coping screw, so I'm just going to gently find our spot. Alright, go in there. Alright, now what you want to do is always go a little in reverse before you go forward, and find your threads first, and then just go with it like this. And just go with it. Maybe that's not the thread. Let me check to see if I do have one that fits this one. Alright, I'm going to sign off. Thanks for watching, guys. Another successful case. I've got to get a different screw to fit in there. Alright, take care.